Have you ever thought about the placenta? It's often called the tree of life, and for good reason. This incredible organ connects a mother and her baby, providing oxygen and nutrients for 9 months. It's a temporary but vital part of pregnancy. After the baby is born, the placenta is supposed to detach and be delivered. But what happens when it doesn't? What happens when this life-giving organ holds on too tightly? Today we're talking about a rare but serious condition called placenta accreta, exploring what it is, why it happens, and how it's managed. This is a story of when the body just won't let go. To truly understand placenta accreta, we need to quickly review how a normal pregnancy works. Inside the uterus, there's a special lining called the endometrium. When a woman gets pregnant, a fertilized egg implants into this lining. The placenta then develops and attaches to the uterine wall, but it stays within that endometrial layer. Think of it like a plant rooting into soft soil. After the baby is delivered, the uterus contracts, causing the placenta to cleanly separate from the wall, and it's then delivered in what's called the third stage of labor. This process is usually straightforward and natural. But in placenta accreta, something very different happens. The problem with placenta accreta is that the placenta attaches too deeply into the uterine wall. Instead of just connecting to the endometrial lining, its blood vessels and other parts grow into and through the muscle of the uterus. It's no longer like a plant in soft soil. It's more like a tree whose roots have grown into concrete. This abnormal attachment prevents the placenta from detaching naturally after childbirth. When the time comes for it to separate, it can't. Attempting to manually remove it can cause massive, life-threatening bleeding. There are actually 3 levels of this condition, based on how deeply the placenta has invaded the uterine wall. The most common form is placenta accreta, where it attaches firmly to the uterine muscle. Then there's placenta increta, where it grows even deeper into the muscle. The most severe form is placenta percreta, where the placenta grows completely through the uterine wall and can even attach to nearby organs like the bladder or bowels. As you can imagine, the deeper the invasion, the higher the risk of severe complications. So, what causes this to happen? The single biggest risk factor is a history of previous cesarean sections, or C-sections. Each C-section leaves a scar on the uterus. If a future pregnancy implants over that scar tissue, the placenta can grow abnormally deep because the scar tissue doesn't have that normal endometrial layer. The risk increases with the number of C-sections a woman has had. After 1 C-section, the risk is relatively low, but after 3, 4, or 5, it climbs significantly. Another major risk factor is a condition called placenta previa, where the placenta covers the cervix. When a woman has both placenta previa and a history of C-sections, the risk of accreta becomes very high. Other factors that can increase the risk include previous surgeries on the uterus, like fibroid removal, being over the age of 35, and having had multiple pregnancies. Essentially, anything that creates scarring on the uterine wall can create an opportunity for accreta to develop. The scary part about placenta accreta is that it often has no symptoms during the pregnancy. A woman might feel completely fine. There might be some vaginal bleeding in the 3rd trimester, especially if she also has placenta previa, but many women have no warning signs at all. This is why routine prenatal care is so incredibly important. The condition is usually diagnosed through a routine ultrasound. A skilled sonographer might notice signs that the placenta isn't separating from the uterine wall as it should. They might see that the clear space normally visible between the placenta and the uterus is gone. Or they might see unusual blood vessels crossing into the uterine muscle. In some cases, an MRI may be used to get a more detailed look and to see if the placenta has invaded other organs. Early diagnosis is the absolute key to a safe outcome. When doctors know about it ahead of time, they can make a plan. The real danger comes when accreta is a complete surprise at the time of delivery. Discovering you have placenta accreta can be incredibly frightening and stressful. The potential for severe blood loss, the need for a blood transfusion, and the possibility of a hysterectomy can be overwhelming for expecting parents. It's a pregnancy journey that suddenly takes a very different, more clinical path. The focus shifts from planning a baby shower to planning for a high-risk delivery. It's crucial for women in this situation to have a strong support system. This includes not just family and friends, but also mental health professionals. Talking to a therapist or counselor who understands perinatal health can make a huge difference in managing the anxiety and fear that comes with this diagnosis. Support groups, either online or in person, can also connect you with other mothers who have been through the same experience, which can be immensely comforting. Remember, taking care of your mental health is just as important as your physical health. If you are struggling, please reach out for help. So, how do doctors manage this condition? The solution is all about planning and preparation. Once placenta accreta is diagnosed, the goal is to deliver the baby safely while minimizing blood loss for the mother. This is not a delivery that can happen at just any hospital. It requires a multidisciplinary team at a major medical center with the right resources. This team usually includes maternal fetal medicine specialists, who are experts in high-risk pregnancies, specialized anesthesiologists, and a gynecologic oncologist or other pelvic surgeon who is skilled at complex surgeries. They also need a fully stocked blood bank because massive transfusions are often necessary. The standard plan for a known placenta accreta is a scheduled C hysterectomy. This means the baby is delivered via C-section, and then the uterus with the placenta still attached is removed in a hysterectomy. This is done to avoid the catastrophic bleeding that would occur if they tried to detach the placenta. The timing is crucial. The delivery is usually planned for around 34 to 36 weeks of gestation before labor starts on its own. This controlled environment gives the team the best chance to manage the situation safely. The baby will be premature and will need care in the neonatal intensive care unit, or NICU, but this planned approach gives both mother and baby the best possible odds. The surgery itself is complex and can be very long. The surgeons have to be incredibly careful to control all the blood vessels feeding the uterus and placenta before they even attempt to remove it. In the most severe cases of placenta precreta, where organs like the bladder are involved, urologists and other surgical specialists will be part of the team to carefully dissect the placenta away. For women who desperately want to preserve their fertility, some doctors might try a conservative approach where the placenta is left in place to be reabsorbed by the body over time. However, this carries its own risks, like infection and delayed hemorrhage, and is not the standard of care in most places. The safest and most definitive treatment remains the planned C hysterectomy. Recovery from this surgery is much more intensive than a standard C-section. It's a major abdominal operation, and many women spend time in the intensive care unit afterward. The emotional recovery can be just as challenging. The loss of fertility from a hysterectomy can be a source of deep grief for many women, even if they had already decided their family was complete. It's the loss of choice. The experience is traumatic, and it's okay to need time and support to process everything that happened. Again, this is where therapy and support groups can be life-saving. Organizations like the National Accreta Foundation and Hope for Accreta provide incredible resources, information, and a community for families affected by this condition. Placenta accreta is a powerful reminder of the complexities and risks of pregnancy and childbirth. While it is a serious and life-threatening condition, it's also a story of incredible medical teamwork, resilience, and survival. Thanks to early diagnosis through ultrasound and carefully planned deliveries by expert teams, outcomes have improved dramatically. It highlights the importance of prenatal care and the advances in modern medicine that allow us to turn a potential catastrophe into a manageable, survivable event. It also underscores the physical and emotional toll that a high-risk pregnancy can take, and the vital need for comprehensive support for mothers and families. The journey may be terrifying, but with the right care, there is so much hope. Thank you so much for joining me to learn about this important topic. If you found this video helpful or informative, please give it a thumbs up and consider subscribing to the channel for more deep dives into health and medicine. Sharing this video can also help raise awareness for this rare but critical condition. Stay safe, stay informed, and we'll see you in the next one.